If you have pain from a rotator cuff tear or a shoulder impingement, then you're in the right place. I'm going to teach you the concepts of how to treat your shoulder without surgery. Take a look at these statistics. In a group of 664 people, 147 of them, or 22%, had full thickness tears in their rotator cuff. Of those 147 people, only 51 of them actually had shoulder symptoms. The other 96 people did not have any symptoms. Phrased in another way, 65% of people with full thickness rotator cuff tears did not have any shoulder symptoms. No pain. The question then becomes, why do some people have pain from their rotator cuff tear while others don't? And the fact that so many people with full thickness tears of the rotator cuff can walk around and perform their day-to-day activities gives support to the notion that you do not need to jump straight to surgery for your rotator cuff tear. These can be treated without surgery, and let's take a look at why. Rotator cuff injuries actually comprise a group of related conditions. So when we say someone has a rotator cuff tear or rotator cuff tendinopathy or shoulder impingement, what we're actually referring to is a series of events that leads to a biomechanical dysfunction that ultimately results in pain. And in order to understand that, we need to do a quick lesson in shoulder anatomy. Our shoulders is a ball and a socket, and the ball needs to stay in the socket anytime we move our shoulders. And so when we are moving our shoulders around, especially with overhead, reaching, pulling motions, that ball needs to stay perfectly in the socket. Now, the most important muscles and tendons that control the movement of our shoulder are our rotator cuff, and we have 4 of them, 1 in the front and 3 in the back. All of these rotator cuff muscles and all our shoulder muscles work together to help stabilize the shoulder. People who have shoulder pain related to the rotator cuff have dysfunctional mechanics. Their ball is not stable in the socket. So every time they lift their shoulder, instead of getting a smooth motion like this, their ball rides high, like this. And this leads to a condition called impingement. Take a look at this picture. The left side shows the rotator cuff resting in a normal position. The right side shows what happens during shoulder impingement. When the shoulder is lifted up, the ball of that shoulder rises high. This leads to a pinching effect where the ball smashes up against the bone called the acromion. Everything in between these two bones gets repeatedly irritated every time the shoulder is lifted up. So over time, this can lead to chronic damage to the rotator cuff tendons. Now, in order to protect against this, there's a sac of fluid called a bursa that sits between the rotator cuff and the overlying bone. This bursa helps to protect our rotator cuff tendons. But instead of the rotator cuff being repeatedly irritated, it's the bursa. And so every time we lift our shoulders up, that bursa is getting traumatized. This leads to inflammation, it leads to swelling, and it leads to a condition called bursitis. So anyone with rotator cuff problems, whether it's from a complete tear of the rotator cuff tendon, whether it's due to a partial tear, or whether it's due to rotator cuff tendinopathy, what the problem is altered mechanics. That ball is not getting stabilized, it's riding high. And when it rides high, it leads to impingement. Impingement leads to inflammation of the bursa, which causes bursitis, and ultimately that leads to pain. And this bursa is pretty large. For a lot of people, the bursa extends all the way down here. And so the rotator cuff is up here, but the bursa can extend down here. And that's why a lot of people with bursitis or shoulder impingement feel pain down here. Gravity pulls all that inflammation, all that fluid all the way down here. And that's also why at night, when you lie on your shoulder, you're actually putting pressure on this bursa. That bursa is inflamed and you're putting pressure on that bursa, which ultimately leads to pain while sleeping at night. So how do we treat this? How do we get people better? Well, step 1 is treating the bursitis, because the bursitis is what is directly causing the pain. And this can be done through taking anti-inflammatory medications, whether that's ibuprofen or whether that's something like naproxen. Usually you need to take high enough dose of these medications in order to get the anti-inflammatory effects, not just the pain-relieving effects. The other thing you need to do is you need to take it sustained, so the levels of that medication build up in your body so you have sustained anti-inflammatory effects over a period of time. And that means taking ibuprofen 600 milligrams 3 times a day, or naproxen 440 milligrams twice a day. And I usually tell people you need to take it for at least 3 days straight. Sometimes we extend it up to a week. But it's important to remember that the anti-inflammatory medications only treat the bursitis. It doesn't treat the cause of the bursitis, which is the impingement. So step 2 is to address the abnormal mechanics. Treatment is focused on strengthening all the rotator cuff muscles in addition to all the other shoulder stabilizer muscles. This is done through a very structured rehabilitation program, and that can be done either at home or at a physical therapist's office. Now, it's important to realize that this process takes time. It takes time to build up sufficient muscles in order to fix the mechanics. But the good thing is most people who go through a rehabilitation program will get better. And once your mechanics are fixed, you now have normal shoulder motion. When you have normal shoulder motion, you no longer get that impingement. No more impingement means no more bursitis. No more bursitis means no more pain. But what about the people who continue to struggle with pain despite doing the rehabilitation program? And that's where injections come in. If the bursitis persists and it doesn't respond to oral anti-inflammatory medications and it doesn't respond to physical therapy, well, this is one incidence where cortisone injections can actually be beneficial. Frequent watchers of my videos know that cortisone has side effects when injected into joints and when injected into tendons. But inherently inflammatory conditions like bursitis, cortisone works really well. Cortisone is a steroid. It's a really strong anti-inflammatory medication. So if we can inject cortisone into the shoulder bursitis to decrease the bursitis, decrease the inflammation, decrease the pain, so that people are able to do more effective rehabilitation exercises, they're able to get more out of their rehab program. And by getting more of the rehab program, they're able to finally fix the mechanics of leading to that shoulder impingement. But if people continue to have pain despite the cortisone injection, or they don't want cortisone injections, well, that's where the orthobiologics come in. Newer studies using platelet-rich plasma or PRP injections to treat rotator cuff problems show promising results. These researchers found that in most patients with refractory rotator cuff tendinopathy, subacromial injections of platelet-rich plasma significantly decreased pain, improved functional outcomes, and resolved sleep disturbances. Please note that there are caveats to everything that I just said, and ultimately treatment does need to be individualized. In general, the younger you are, especially if you're in your 20s or your 30s, and your rotator cuff tear was caused by a trauma, chances are you may have better outcomes with surgery. With that said, most people who come through my clinic see surgery as a last resort. They want to maximize non-operative treatment options in order to get better. And if we think back to that initial study that 65% of people with rotator cuff tears can walk around and do all their daily activities without any shoulder pain, then it makes total sense that we can treat rotator cuff problems without surgery. Thanks for watching. Please share this video if you found it useful. You can find me on social media. I'm on Twitter at Peng MD. I also write on my blog at jeffreypengmd.com. See you next time.